So when it comes to vitals, I want you to mind through the process as if you were doing vitals on me normally, right? So you'll still ask me those questions. You'll still go through that process as if you were doing vitals. You just won't actually do it, all right? When it comes to the testing, if you need to do any of the testing, I'm sorry, you need to do the urine testing, let's say. You'll just take one of these, you'll take this urine cup, pretend like, you'll still tell me how I'm going to collect the urine. So still verbalize to me if I have to do a dirty or a clean catch. And then you're basically going to just come here and then run the pregnancy and the urinalysis. Alright? So you're just going to run the pregnancy and the urinalysis on the patient as if you collected the urine normally. Alright? So that's how that process is going to work. With the flag system, with the flags, you're going to update it throughout the visit. Alright, so you can tell me which one you would put up.
Will the flags be on the table like that, or will it be on the door?
It's on the door. It's in the, you're doing it in the exam room.
Oh, okay.
You don't have it. Alright, so that's it. You know, treating it like a real patient visit. If you have any questions, anything that you're catching in terms of anything she might have skipped, that's okay. Great. You're catching on to stuff. Write it down. We'll go over the case after the visit ends. Alright? So just do not interrupt while the case is going on. Alright? We'll talk about it once the case ends.
I'm gonna be quiet for 45 minutes.
All right. One second. All right, ready to go? I'm your patient. I'm waiting up front. By the way, you guys can assign your patient. So our provider today is going to be Daniel Frogel, and we're going to be in room number 2. Daniel Frogel, room number 2. For those of you who already assigned provider, it's very easy to change it. On the top right corner where the provider's name is, you click it and you change it. That's it. That's all you have to do to change provider. All right, so if you already assigned provider on your chart, just change the provider by clicking the provider's name and you'll be able to change it very easily. In fact, sometimes when you're on site, you may have to do that because what happens sometimes is, oh, Frogel got really busy. Frogel's stuck with a patient with like an emergency. All right, so then you'll take over for this. I'll take over for this patient. So then go, all right, let me just go take this patient because he's busy with an emergency.
So you said we could just change them. Whatever we could
Yeah,
change.
if you ever have to change the provider,
Yeah.
all you have to do to change it is just click on the name of the provider and then you can change it. That's it. It's very easy. All right, cool.
You have to do the room and stuff, right?
Yeah. So room number 1 and Daniel Frogel. So go ahead and prep your chart, and then whenever you're ready to come grab your patient, I'll be waiting for you outside. There you go. All right.
Hello, patient test. My name is Sophia. I'm Miss 5, and I'll be assisting the provider today.
Nice
You
to
can
meet you.
follow me.
Sure. Yeah, you just tell me that. Perfect. Good.
Have a seat.
Yeah.
So before we get into why you're here today, let me just quickly verify your name and date of birth.
Yeah, of course. My name is Scribe 14 Test, and my date of birth is January 1st, 1990.
Also, can you please verify your pharmacy for me, please?
Yeah, can we get rid of whatever's in there? I think I mistakenly put in the wrong one. There is a CVS. It's on 86th Street and Amsterdam Avenue. Could we do that one? CVS on 86th and Amsterdam. Yeah, that's the one.
Again, before we start to discuss why you're here today, I would like to take your vitals.
Sure.
Do I put it on the
So again, you're just gonna mind through the process as if you were actually just think about all the steps.
Can I just take the height and weight first?
Yeah, sure. Yeah.
So can you tell me your height, please?
I am 5'6", and I'm 160 pounds.
Alright, I'll take your blood pressure.
Sure. You can just go through the steps, right? What are those things that you're telling me? Just act as if you're actually gonna do it.
Alright, so your blood pressure is
No,
what?
so actually go through the questions.
Oh, okay.
Right, so all the
Alright.
different-
Can you please uncross your legs?
Okay.
Relax your arms, and which arm do you
Yeah,
prefer?
right arm is fine.
Alright.
So blood pressure is done. What else do you have to do?
You have to take pulse.
Yeah. Pulse, okay. How are you gonna do that? What do you need to do with the pulse ox?
Yeah, with the pulse ox, I'm gonna wipe it first, and then the opposite hand I will
Okay.
place it in,
Anything
and
else? Like-
also the temperature while, let's say,
Yeah.
before the blood pressure. During the blood pressure, I'll do it,
Yeah.
and then that's it. Okay. So, should I just record number?
Yeah, you can put the blood pressure as, let's do the blood pressure as 120/80, that's fine. Let's do a heart rate of 80, temperature you can put 100.5, temperature 100.5, respiratory rate is normal, and O2 sat is 99, let's say. So everything normal except there's a patient has a temperature of 100.5.
Oh, alright, before we ask you why you're here today, I would like to know your medical history. Do you have any allergies to any medication?
Yeah, sure. I'm allergic to a medication. It's called Z-Pak. I'm allergic to a medication called Z-Pak. We'll do it again. Z-Pak. Medication.
I have a question while she's searching it. Can I ask you something?
Save it for later.
Okay.
Save it for later.
Just come up.
There's a reason. Maybe one spot, bro. Z-Pak.
Alright, anything else?
No other medication allergies, just the Z-Pak, the Thromax Z-Pak.
Alright, do you have any medical problem?
Yeah, I've been diagnosed with I've been diagnosed with thyroid condition. With a thyroid condition.
Anything else?
I also have GERD.
Anything else?
No, just those two.
Are there any current medications you're taking?
Yeah, I'm taking a medication. I'm taking first of all, I'm taking Tylenol for my fever.
Anything else?
I'm also taking levothyroxine.
Anything else?
I'm taking omeprazole.
Anything else?
Just the levothyroxine and the omeprazole.
Alright. Now we will check your medical history. Do either of your biological parents have diabetes or high blood pressure?
Yes, my dad has high blood pressure, and my mom has diabetes. My dad has high blood pressure, and my mom has diabetes.
Dad has
High blood
high
pressure?
blood pressure and mom has
Diabetes, yeah.
Social history. Do you or have you ever smoked tobacco?
Yes, I do currently smoke.
Are you a everyday smoker or Sunday smoker?
I'm a Sunday smoker.
Current Sunday smoker. Do you or have you ever used? No, sorry. It's okay. Have you taken tobacco cessation counseling?
What do you mean by that?
Did you have counseling for?
Yeah, I mean, people tell me to smoke all the time. I stop smoking. My kids are tired of it. They think I'm gonna die. In fact, they told me today.
Do you have any surgical history?
Yeah, I've had a few surgeries. I had my gallbladder removed.
Can you Google the test?
Anything else?
I also had surgery on my knee.
Which knee?
It was my left knee. My left knee surgery.
Anything else?
No, just those two.
All right. What's the reason for coming here today?
So I've been having some urinary issues for a couple of days now, but this morning I noticed I started having some blood in the urine. So I was having like some discomfort while urinating for a few days now, and then this morning I saw blood and I freaked out. So that's why I'm here today.
I couldn't hear you.
So I've been having some discomfort while urinating for a couple of days, and then this morning I noticed some blood in the urine as well. So that's why I'm here today. But yeah.
When did it begin?
The discomfort or the blood?
The discomfort.
Discomfort started, I'd say 3 days now. It's been going on for. It's been going on for 3 days now. Yeah.
Okay. Do you have urinary frequency?
Oh yeah, I've been urinating quite frequently.
Do you have urinary urgency?
Yeah, yes, it is urgent. Yeah.
So you said there is blood in your urine.
Yeah,
Right?
there's some blood in the urine.
Is there any history of urinary infection from before?
Yeah, so I've been prone to UTIs, and also I've gotten kidney infections a couple of times as well. So So I've been prone to UTIs, and I also have a history of kidney infections. I'm prone to UTIs, and I also have a history of kidney infections.
And you had kidney.
Yeah, and I've also had multiple kidney infections. Alright, I'm prone to UTIs, and I've also had multiple kidney infections.
Was there any genital pain?
No genital pain, no.
Any discharge?
No genital discharge.
How about STD exposure?
No,
STD
no
exposure.
chance, yeah.
Did you take anything?
Yeah, I tried taking some Tylenol for my fever that I was having as well. So I tried taking some Tylenol for my fever. Yes, the fever started pretty much this morning. Alright, so I tried taking some Tylenol for a fever that began this morning.
And did it help?
I guess it went down a little bit. My fever this morning was at around 102 almost. So it did go down a little bit because my fever this morning was 102.
Do you have, you're a female, so do you have, when was your last menstrual cycle?
It was around 1 week ago. Last week, so 1 week ago.
Do you have any chronic conditions such as asthma or anything else?
I just have like the thyroid condition and the GERD. Sorry, is that what it is?
Yeah.
Thyroid and GERD. That's all I have.
So I will take
Be inside
the
of it.
POC test.
Okay.
So urine. Do I just put?
Just tell me how I'm
Oh,
supposed to
so-
collect the urine.
So
So you can just tell me. Yeah.
okay. So we'll use the urinal. What was it? UA test
Mhm.
and
How am I collecting the urine? Tell me. What am I doing?
so we'll give the patient this
Mhm.
and ask them to pee.
Okay.
Since there was no STD exposure, it could be, I think the clean catch.
Okay. So how do I do that? Why is
Um,
it called a clean catch?
so what we'll do is you will have to take the wipe and you will have to wipe back and forth 3 times
Mhm.
and then pee a little, wipe back and forth 3 times, and then midway you will catch your urine, and that's to check if you have any infection or not.
Sounds good. All right. So I give you the urine cup. You can come around. You can run the urinalysis and the urine pregnancy on the patient. So come around.
Process.
Right open.
They say, like,
How would they know?
some of the symptoms will be like they've been exposed or they like are there because of STD.
So again, this is going to be done outside the room.
Then you don't.
You get the urine, you go to the lab, you run the testing. So we're pretending this is happening outside the room.
So for urine pregnancy, you will just take.
Just do it. Yeah.
think it's serious. Yeah, because hematuria is like one of the symptoms of it.
So you drop 3 to 4 drops here. 1, 2, 3, 4, and then you will wait 3 to 4 minutes. Make sure to have a timer. And then after the time comes, the doctor, yeah, you wait.
In the lipstick? Yeah. Or you put the inside of it.
So you wipe down the entire thing first. Oh, that. And then you will take the strips. Make sure you dip completely inside the thing, and all the
She didn't ask.
squares need to be covered. And then when you see them, you just no, sorry. Yeah.
And the strap test is the new cover and the fluid is what covered in the
You have to label that, let's say, for pregnancy, you can do name and date of birth. Or it is okay. When the results come, so make sure to include it. And then you can go to the
Over there. Leave the pregnancy in the lab.
Oh,
Hello. You want to review?
Yeah.
So we would typically do a urine culture. I don't have it. Just to run it. But you should.
We don't ask it.
It's a lab.
Yeah,
You wouldn't add it in. Are you talking about physically?
like, are we
In the
putting
chart?
it? Yeah.
No, not until the provider tells you.
Okay. But we perform it and leave it in the lab.
Oh, she's
Just like a joke.
just
You
joining
always
the
make it.
business.
The provider will tell you.
Like the results. So that's what we're doing.
Hello, doctor.
Are you looking for Dr. Frogel?
Yes.
Frogel's just a bit busy. My name is Dr. Sultan. I'll be taking over for this patient. So if you don't mind just changing that for me when we get into the room. But yeah, go ahead. What's going on with this patient?
Today we have a patient, 33-year-old female, reported having dysuria for past 3 days.
Mhm.
Patient also reported having being prone to UTI and had multiple kidney infections.
Mhm.
Patient had no general pain or discharge and had no STD exposure or urinary frequency, or patient did have urinary frequency, urgency, and blood with urine. I've run out POC tests for pregnancy test and UA test.
Okay. Do you have the UA slip on you?
Oh my God. And here's the results for the UA.
Okay, and let me take a look at the pregnancy. All right, the pregnancy test is negative. Anything else? No?
No.
All right, let's get into the room. Hello, patient test. Patient test, my name is Dr. Sultan. Dr. Frogel, who is supposed to be in this room, is just a bit caught up with another patient. So I'll be taking over for the rest of the visit. Now, patient test, my colleague here informed me that you started having some discomfort while urinating, which began around 3 days ago. All right? And along with that discomfort while urinating, patient test, you informed us that you were having some urinary frequency and some urinary urgency as well. And patient test, you are also experiencing some blood in the urine. When did that bleeding begin? When did you first notice that blood in the urine? You noticed that blood in the urine this morning, so you only saw it this morning. Okay. And patient test, you have been prone to UTIs, and you noted that you've had multiple kidney infections to us. And you are having a fever. Any chills? You are having some chills as well? All right. And are you nauseous? Have you been vomiting? You do have some slight nausea, but no vomiting. Okay, so the patient does have some chills and some slight nausea, but no vomiting. No vomiting. All right. And patient test, any pain in your abdomen? You do feel some lower abdominal pain. So the patient does have some lower abdominal pain. Okay. And do you by chance have any pain in your back that is abnormal? Any sort of mid to lower back pain? You do have some back pain as well. And with that back pain, is it on the left side, the right side, both sides? You primarily feel it on the left side of your back? Okay. So the patient does have some lower abdominal and some lower back pain. And the back pain is particularly in that left side of the back. All right? So it's a left-sided back pain. And patient test, you told us you took some Tylenol for your fever this morning, which gave you some relief of your fever symptoms. Patient test, when was the last time you had a UTI? The last time you had a UTI, your last onset of a UTI was last year? Was 1 year ago? And what about your last kidney infection? The last time you had a kidney infection was 3 to 4 years ago? All right. And the last kidney infection was 3 to 4 years ago. Alrighty. Patient test. So patient test, based on your symptoms, my colleague did run some testing. We'll talk about that in a sec. But before that, I just want to go ahead and do a quick physical exam on you first. So we're going to do a quick physical exam on you first. So patient test, let me take a look at the back of your throat really quickly. So, alright. And the back of the throat looks fine. No issues with that oropharynx exam. So the oropharynx exam is normal. Patient test, let me take a look inside your right ear. The right ear looks clear as well. And let me take a look at your left ear as well. Left ear is also pretty much fine. So the right and left ear exam is normal as well. Patient test, let me listen to your lungs now. All right, the lung sounds are normal. Lung sounds are normal. And let me listen to your heart. Heart sounds are also good. They've got a good heart. All right, and finally, patient test, I'm going to feel your abdomen. So let me feel the abdomen here. So the patient does have some suprapubic tenderness. Some mild suprapubic tenderness, along with some left flank tenderness. Some left flank tenderness. There is no guarding or rebound tenderness. The bowel sounds are normal. The bowel sounds are normal. And there's no enlargement to any of the organs. And there's no tenderness to the right lower quadrant. All right, no tenderness to the right lower quadrant. So just some mild suprapubic tenderness and some left-sided flank tenderness. No guarding or rebound. Normal bowel sounds, no tenderness to the right lower quadrant, and no enlargement to any of the organs. Alrighty, patient test. So patient test, like I said before, my colleague ran a urinalysis and a urine pregnancy test on you today because of your symptoms. The UA that we ran did show signs of some sort of infection. And by the way, your urine pregnancy test was negative. You guys can put random stuff for the UA results, by the way. Just put random values for the UA results.
What was the diagnosis?
I didn't get one. You can just copy this for the UA results. Just don't put everything. All right, patient test. So, based on your symptoms today, I believe you might be having another kidney infection. So what I'm going to do is I'm going to diagnose you today with acute pyelonephritis. Acute pyelonephritis. A patient test, because you're having this kidney infection, that acute pyelonephritis, the medication that I would like to prescribe you for the pyelo is called Cipro. And patient test for that Cipro, we're going to take 500 milligrams, 1 tablet. Write it down if you don't know it. Cipro, 500 milligrams, 1 tablet, twice a day. Write it down if you don't know the exact name. Just write it on the sticky note. Yeah, the other sticky note, just write it down there. We're going to do Cipro, 500 milligrams, 1 tablet, twice a day for 7 days. That'll be for the kidney infection. Patient test, because you're having this kidney infection, you also have, what I'm going to do today, let's go ahead and also, let's add in a secondary diagnosis of left flank pain. Left flank pain. So patient test, we're also going to diagnose you today with left flank pain. Now, what concerned me with your symptoms and that left flank pain and that blood in the urine that you're having is you might be also having a kidney stone. So patient test, because you're having that left flank pain, I want to get a stat ultrasound of the abdomen on you. So we're going to get a stat ultrasound of the abdomen on you today, just to make sure we can rule out any kidney infections. So we're going to get a stat ultrasound of the abdomen because of your left flank pain to evaluate for any kidney stones. So we're evaluating for kidney stones with that ultrasound, with that stat ultrasound. Write it down. So we'll get that done as well. Now, patient test, because you're going to go get that ultrasound done today, what I'm going to do is I'm going to administer the first tablet of the Cipro in office to you just so you can get started on that medication. So because you're going to that ultrasound today, I'm going to administer the first tablet of the Cipro 500 milligrams in office just so you can get started on that medication. All right, so I'm going to administer 1 tablet of the Cipro 500 in office today. Patient test. Finally, a few other things. Let's do this. For the pyelonephritis, let's just send off a urine culture to the lab as well. So for the pyelo, we're going to send off a urine culture to the lab just to make sure we're not seeing anything that we're not supposed to. So urine culture, let's get that urine culture done as well. For that pyelonephritis.
Routine or staff?
There's only routine first.
I was only
Culture.
Also for that pyelonephritis, let's give the patient a list. Let's do an urgent nephrology appointment for that pyelonephritis. Let's do an urgent nephrology appointment for that pyelonephritis. Patient test, we're going to get you that urgent nephrology appointment, just so you can follow up for that kidney infection patient test. All right, so just so you can follow up with someone for that kidney infection. And our aftercare team will reach out to you within 3 days to schedule that appointment for you. That is pretty much all from my end, patient test. We'll send off that medication to your pharmacy, the Cipro. We're going to get an ultrasound on you as well, and we'll set you off with that urgent nephrology referral for that kidney infection. Now, patient test, a few things to remember. Because you've been prone to those kidney infections, if your symptoms begin to worsen, if these symptoms begin to worsen, or if your symptoms have not improved at all in 3 days, please return to the office for re-evaluation. All right, so please just return to the office for re-evaluation. Patient test. Also remember to stay well hydrated. Just remember to stay well hydrated, and that should help flush out that infection. All right. Continue to take Tylenol and ibuprofen to help with your fever. So continue taking Tylenol and ibuprofen as indicated by the bottle to help with your fever. So continue taking Tylenol and ibuprofen as indicated on the bottle to help with your fever. That is pretty much all from my end, patient test. My colleague here will take over for the rest of the visit. You can let them know if you have any questions. Any questions for me before I get out of here?
Yes, so
To verify on the chart. This is when you can look up the medication names and make sure it's the right one. So look up Cipro medication.
I also confirm this. The clinical exam.
So what are you verifying with me?
So doctor, you said that the patient is diagnosed with acute pyelonephritis.
Yeah.
And you told them to take, you ordered Cipro 500 mg 1 tablet twice a day for 7 days.
Yep.
Left.
You also
No, I didn't.
ordered a stat ultrasound for abdomen,
Mm-hmm.
and you told you gave a Cipro 500 mg 1 tablet administered for today,
Yep.
and also urgent nephrology referral.
Yeah.
You also said that diagnosed the patient with left lung pain,
Yeah.
and you ordered urine culture.
Yeah.
Flank pain.
Yeah. So we can do a 4 code for the visit today. So we can confirm the billing code as a 4 code for the visit today. Anything else that you need from me?
Also, if for the patient, if the symptoms begin to worsen or have not improved at all for 3 days, then you advise the patient to reevaluate, come back for reevaluation,
Yeah.
and tell them to stay hydrated and continue taking Tylenol and ibuprofen as indicated on the bottle to help with the fever.
Yep. Sounds good.
All right. I will sign off now.
Okay. Make sure to put in everything. Just put down other stuff missing, right? So medications.
Yeah.
I'll put that in. Yeah.
Left link is not popping up for this restriction.
It's okay. Just type in .com.
So the doctor stays in the room.
No, I left.
So in the billing, you just get them back.
You already confirmed the billing
Okay.
before, but put in the other stuff.
Oh.
You don't have the meds in the chart.
Oh.
You don't have the ultrasound. Put it all in. Right. Just type in .com.
You
Never
sign
type
over
in
and then you
acute,
sign.
left, right.
But after verify.
Okay. Oh, you did one. No.
I do have to verify something. I don't see you ordered a UA and a pregnancy test. That was supposed to go under acute pylori. And this was feeling negative, and then the results for today.
We'll go over it.
Did you add the labs? Oh, you didn't assign it to a diagnosis. Did you rank it? Document? Hold on. Yeah. So here you have to assign these to every diagnosis.
It's gonna be for the acute diagnosis. For pregnancy test is not like a separate diagnosis.
No, it was all for left.
You're close
like,
there almost. I mean,
that's what
you
you
have the order.
did though.
Just have to put in
And your analysis too. The one's from CT.
ultrasound sizes.
What? It was urgent.
Just urgent.
Oh yeah. Oh never mind. Why does it show a stat though?
Because it's always in the checked off in the box. Though. See?
Kidney
The box is always checked off.
The patient is having left flank pain.
Wait, it was stat.
No, it's urgent.
Was the ultrasound stat or it was stat? Okay. Yeah, he changed it last minute, I think. So we have to change the one.
If it's that ultrasound, you have to look the MA and the, sorry, you have to look the PCR.
PSR.
PSR. When do you say that?
Just put any version.
Oh,
Or stack yourself to the front.
oh, it is
Why
that.
didn't you say the after?
Oopsie.
You said after.
Oh my god. I feel like I need. Well, we're gonna shadow someone and then someone's gonna shadow us.
Yeah, this is gonna be easier now.
Yeah, so it's gonna be bullying us for a week.
No, you have to put the name. Yeah. Stat US out.
Yo, imagine the person that has to shadow is like fucking sick of it. What you said?
Wait, did he say after care's gonna call them? Did he say after care's gonna call them? He did say that. Because I thought he said that. Or
For urgent?
But I think you just supposed to assume. You're just supposed
But isn't it stat? A stat.
But the ultrasound was
Ouch.
that.
Don't you send them to the front
Yeah.
for the stat? So why do
Yeah.
you say after?
Because the referral to the
Nephrologist.
nephrologist.
It's urgent.
Oh, this.
It's
Oh yeah,
urgent.
yeah, yeah.
Shit, I forgot about the
So
stat
even
thing.
though it's an urgent
Yeah,
referral,
I'm gonna
they're still gonna get sent to the
If
front
there's something
because-
that you have to do.
Yeah. Okay, that makes sense.
Yeah.
I get confused. Damn, I was
I was gonna sign.
45 minutes to break.
Okay. After you sign off as scribe, what do you do?
DRS.
Yeah.
Oh, you give the summary to the person. To the patient.
Like, would you like the summary?
No, like you have to tell them like, oh, okay, like you've been diagnosed with blah blah blah. Would you like a printout? No, the fuck. Okay. And get out. Oh no, they have to go to the front desk.
They want the printout.
No, they have to go to the front desk to speak to the PSR.